This segment of Delmarva Life is brought to you by Thomas Podiatry and Associates, giving you a foot to stand on.
You might not think making a priority of taking care of your toenails is important, but have you ever experienced the aches and pains and annoyances of an ingrown toenail?
Yeah, it's not fun, and in some cases they can become severe. Delmarva Life's Katie Zerilli visits Thomas Podiatry and Associates in Salisbury to learn about how to both treat and prevent these nasty nuisances.
And then we will use a hemostat to remove the nail. It kind of flips out the nail.
Dr. Trina Monis finds feet fascinating.
You have to get an injection here and here to numb up the toe.
And fancies helping yours flourish. Part of that pursuit is taking care of ingrown toenails.
But ingrown toenail is basically a condition in which the corner or the side of the nail goes into the skin. Pierces into the skin, causes pain, redness, swelling, can even lead to infection.
Dr. M says there are a couple causes for this Tootsie trouble.
One thing is genetics. In the family, sometimes their nails are shaped a certain way within a family, so it gets passed down, and sometimes when patients come in, they're like, oh, my mom, my dad had this, and now my kids have it. So it can be genetic. It can also be caused by injuries, such as playing sports, like playing soccer. If you drop something on your toe, you stub your toe on your bedpost. Tight shoes, like ill-fitting shoes. Look at your mom or your grandma and see what their feet look like.
Yeah. Underlying health conditions also potentially present the problem. Dr. Monis adds that no age is exempt. These pesky pests occur most often on the big toe.
That is the toe that you propulse off of, the toe that happens to stick out more and you bump the bed with. The way that certain people walk, they put more pressure on the side of the toe in an abnormal way. Talking
Treatment, she says there are a few at-home fixes to try.
Warm water soaked with Epsom salt, it helps to pull the drainage out, making sure you're cutting the nail properly, making sure you have good fitting shoes. You can even put a little bit of a topical antibiotic on it. Sometimes people take like an anti-inflammatory, like an over-the-counter.
Add to that wearing open-toed shoes. One remedy she does not recommend, what she calls bathroom surgery.
That's not good, but they want to try to dig it out themselves, and that can actually cause it to become worse. So then at that point, they're in that much pain, they have to come see us, and typically we would do a procedure to help relieve that and maybe even put them on antibiotics if there's a bad infection. After it gets numbed up, we'll put on a tourniquet, okay, to stop it from bleeding.
In severe cases, the solution is a procedure.
We can remove that ingrown toenail, and if it's infected, I typically would have to numb up their toe, take out the corners of the nail, and allow that drainage and stuff to come out, put them on oral antibiotics, let it calm down, let them do some wound care for a few weeks, and then bring them back, numb up the toe one more time, kind of clean out the edges of the toenail, and then we can put a chemical in there and kill the root of the nail in that corner so it doesn't come back again.
If it sounds like she's overjoyed about this operation, it's because she is.
This is like my favorite procedure to do. It's so satisfying to remove that ingrown toenail. They're usually longer and thicker than you can see from the outside, and it's literally like instant relief that, it's been removed. The patients take pictures, they look at it, they can't believe how bad the ingrown toenail is.
She's even experienced it from a patient perspective.
Believe it or not, when I was actually in podiatry school, I was third year, I actually had an ingrown toenail, and so one of my classmates, under the direction of our attending, I let him do my procedure. So it was like practice for him. It was good for me.
So not only does she have the knowledge, she also has the understanding.
That's another thing, like I know it hurts. So even getting the needle in the toe hurts. So I tell patients this is going to hurt, but I will talk you through it. So I know exactly what the process is because I've actually had it done myself.
Of course, don't forget that proper foot care can prevent complications like this in the first place.
Foot hygiene is a big thing that people don't realize how much it can really affect you. I see, unfortunately, that even you would get in the shower, people just take a shower and they just let all the water run down to the feet and then it's clean. But unfortunately, it's not necessarily the case. You know, you should always take a shower, head to toe, and their feet are last, because everything that's dirty up here goes down there, and that can cause infection and problems with, you know, poor hygiene. You know, you can have bacterial infections, fungal infections, that type of thing. So hygiene is a big thing. You know, keep your nails cut short, make sure that you're wearing proper shoes, and then, you know, no bathroom surgery. It's chemical here to put down the corners of the nail. And
this podiatrist wants you to take the right steps for feet that feel great.
And Dr. Monis says ingrown toenails can also be caused by bone spurs underneath the nail. I mean, you know, they're nasty to talk about, but I know a lot of people have experienced them. It's just nice to know
Yeah,
there's relief.
Yeah, there is relief.